I just got to put my got it. And we know that presently our hospitals are really in crisis. And in the last number of weeks, especially the pediatric hospitals, the aid is great. And what we're seeing everywhere is that there are long waits. There's for surgeries are canceled, people are being moved about, and there's not enough beds to take everybody. So we really have a very, very difficult situation. Here in Niagara, we have 3 health systems, and a lot of people forget that. You know, we forget that aside from the Niagara Health System, we have West Lincoln Memorial Hospital, that's part of the Hamilton Science, and we also have Hotel Dieu Shaver, that's a rehabilitation. And all of them are struggling, all right, with underfunding, staffing shortages at all levels, COVID outbreaks in the hospitals. Plus, we have real problems with, as you know, with emergency ambulances, long wait times. So it is difficult. And I just want to go through just a quick synopsis for each one of these systems. So it gives us an idea of how it's impacting us here in Niagara. And this is just, to be honest, it's just really at the surface of it. So if we look at West Lincoln, it's a 60-bed hospital in Grimsby. Its surgical wing was closed for 9 months. They've just recently reopened it, and it's to relieve the pressure of the backlog of day operations from the Hamilton Science. The maternal or obstetrics was closed for a long time, and now they're just starting to reopen it. But you know what? Like, it's only 4 days a week, 3 nights. What happens is whenever there's really a big problem in Hamilton Health, and now we have with McMaster, what they do is they redeploy staff from the West Lincoln Hospital to the hospitals in Hamilton. And so it creates a big problem for the hospital. There's no surgeries. They could close the maternity wards, etc. In the last 5 years, most of the staff is new. So that's difficult. The other thing with regards to them is they usually have, it's a 60-bed hospital. It's not a big hospital. They're starting to build a new hospital behind the old hospital. They usually have typically more people in the waiting room than what during the day than they do have beds. So wait times can at times be long. The Hotel Dieu, once again, it's got a high outpatient clinics. There's a lot of people that come to the hospital. You know what? It relies on 142 volunteers to help give services to the people, to the patients, and there's 134 usually. That's the number of beds that they have. They depend on donations, over $1 million, just to help update some of the equipment. You know, and I was there a couple of days ago, and honest to goodness, they were, because there's a COVID outbreak, patients were being wheeled in and out. They were all wrapped in blankets and whatnot, wheeled in from the main hospital into where the rehab section is, and then wheeled back out again. And, you know, like, it's kind of cold out there. If we look at Niagara Health System, they have, like everywhere else, a huge staffing shortage. And because of COVID, they end up having to redeploy and this staff numerous times. So urgent care, Fort Erie was closed for a number of weeks. Port Colborne, it's off and on for a couple of days. In Welland, there was no surgeries for a while because they had one anesthesiologist and he got ill. And so all the emergencies were being redirected to the Falls and St. Catharines, and already overloading those two systems. And by the way, the Niagara Health System is one of the 10 top busiest, is in the 10 top busiest ERs going on. So the staff is working extra shifts. They're postponing their vacations. They're doing extra hours. They're very, very stressed. It's right now, because of the pediatric surge, all elective surgeries in the St. Catharines Hospital is being moved to the Falls, and many surgeries are being rescheduled. And just to let you know, they usually have around 400 people a day going through their ER, so that's a lot. There's a huge backlog in surgeries, just like at the Hamilton Health Science. And so there's over 5,000 patients waiting for orthopedic and cataracts mostly. And they have stated a few months ago, the Niagara Health System, the CEO stated that once the new hospital in Niagara Falls was built, that they would be closing the urgent care in Fort Erie and Port Colborne, and we have fought very hard to try to keep that. There's a motion that was passed, it was brought forward by Jeff Birch, with regards to keeping the Welland Hospital a full service hospital. That passed on April 13th, and we're really wanting to keep that. There are so many positions that need to be filled, not only for nurses, RNAs, RPNs, PSWs, medical support staff, but everywhere, be it with dietary, health and safety, like it's just incredible. So there are so many stresses on our health system. And as you know, one of the things that the government is trying to do is privatize. And if you're privatizing and taking services out, then that means less funding. And the hospitals can only keep beds open if they have funding for it, or the staff. All right. So it has been it's a very stressful situation for everyone, and in all three systems. And everyone is working really hard to try and meet the needs of the patients that are presently in the hospital. All right. So that's sort of a little synopsis in terms of what's happening in the Niagara Region's hospitals and to our local health services. So I'd like to now present you Natalie Mira. All right. She is the force behind the Ontario Health Coalition. She's been the executive director for 22 years. And both of us have been working together for 22 years. That's just incredible. She's built the Health Coalition into the largest and broadest public interest group on healthcare in the province. And, you know, the Health Coalition represents more than 750,000 Ontarians, and there's more than 500 member organizations and 50 local chapters. So, you know, she's done a fantastic work. The organization is in every little part of Ontario. She's a former board member of the Canadian Health Coalition, and she spearheaded numerous national campaigns to safeguard and improve single-tier public medication, Medicare, I should say. She's an author, numerous books. incredible number of reports, and I'm sure some of you have seen them, especially in the last few years on long-term care and the private clinics and what's going on in a variety of areas. So it gives me great pleasure to present Natalie.
Thanks, Sue, for those very kind words. Thank you very much. It's really disturbing to hear that kind of litany of services that have been under threat and closed or temporarily closed across Niagara and into Grimsby. Very, very worrisome indeed. And so we asked Sue if we could work with you, with the Niagara Health Coalition. And it's lovely to see you here and people that I haven't seen in a long time as well. Hi, Fiona. I see Teresa and Zavino here. Thank you very much for joining. Julia, Carol, all of the people who've put so much time, Ivan, and effort into protecting your local health services in the Niagara Peninsula, really, and all the new people. Thank you very much for joining. I see some of you just heard about this meeting within the last few hours. We're glad that it reached you. It's we have a lot of members, but we live on their donations. It's like the donations of people, and we only really have 3 staff, and mostly we're volunteers. We don't have money to do massive TV advertising and so on. That actually costs about $1 million to do ads that anyone even sees on television. So it's hard sometimes to get the word out. We've been relying on social media, and it seems to have done a good job this time in reaching more people, and we can build on that as we go forward. But I'm really happy that you're here because, I think because you've seen it in the news, that the hospitals really are in crisis. It's a bit odd what's going on because in the legislature, the Ford government keeps denying that there's a crisis. It's just the weirdest thing. But I want to describe to you, so from a patient's point of view, what is going on in the hospitals right now. So this is just from a couple, this would have happened about a week and a half ago. This is a woman who's got a daughter who's got disabilities and was trying to get into hospital. She said, my family lived this nightmare when my 6-year-old daughter was rushed to hospital, barely able to breathe last week. Now she's out of hospital and my cortisol levels are down a bit. I can share our experience and some questions I'm asking. When we arrived at emergency, families were overflowing from the waiting room into the parking lot. Security guards were tasked with maintaining order. I elbowed my way in and was immediately seen due to how acute my daughter's illness was. Kids who weren't so sick that they needed the hospital to keep them breathing were facing up to a 14-hour wait to see a doctor at one point. There simply was not enough staff. I witnessed a 3-year-old with a bleeding laceration on her forehead turned away from the operating room, from the emergency department. A couple of kids showed up who required all the emergency staff to keep them alive. The triage nurse explained to the waiting room that their wait would be longer. Parents were irate. A mother screamed at the nurse. Security intervened to protect the nurse from 2 fathers. During this period, there were no staff available to monitor my daughter. I was up to me to monitor her oxygen levels and administer oxygen and Ventolin. The triage nurse did her best to check each kid who arrived, but it was impossible. She simply did not have the resources and the tools she needed. She kept her cool and did her job skillfully and empathetically despite abuse from stressed out parents. I left her a love letter. Eventually, my daughter received the IV and lung x-ray that she needed. We were admitted into acute care where we spent 3 nights with excellent care. She played soccer this weekend without Ventolin, so she's back to normal. It will take me longer to recover, but I'm left with questions. How can we expect people to work 12-hour shifts under that kind of stress and not burn out and leave nursing? I would have lasted approximately 5 minutes in that job, and it's just the beginning of the flu and virus season. This is year 3 of the healthcare crisis. There are not enough healthcare staff, and those left are burned out and working sick often. What is the game plan? We can't expect these people to prop up the system forever at the expense of their own mental and physical health. How can we be kinder to each other? I get that having a sick kid and emerge at 3 a.m. who can't see a doctor is awful, but I was horrified at the behavior of some parents. And then she goes on and asks about the, why vaccination rates and things like that. Anyway, that's just one account of what's happening in the pediatric hospitals. And, what's happening in the pediatric hospitals is new, but it is what's been happening in the adult hospitals. To some level, we were in crisis before the pandemic. We choose our words carefully in the Health Coalition. We try not to overuse the word crisis because it has less meaning if you use it all the time. But we were in absolute crisis leading into the pandemic. Now we've had, 3 years of pandemic, and the staff have left really in droves by the thousands. We really are, I just don't even have words to describe the situation in our public hospitals. And if Ontarians don't pour out in over this, to try and get the government to take action to address this, I don't know what we would possibly do it over. So I just want to give you a little background. There's no sort of big surprise that Ontario finds itself in this kind of disaster. Ontario, the Ministry of Health and successive governments have pursued a policy of dehospitalization. It's been cornerstone. So they've pursued a policy of cutting hospitals, downsizing our public hospitals. It's been the case for decades. Before leading into the pandemic, Ontario, I'm just going to share my screen for a second here, had the fewest hospital beds left per person of any province in the country. And you'll see it's by far, on the East Coast, the provinces have double per person the number of hospital beds we have. See, you can see this chart sort of shows it more visibly at the bottom, but there's Ontario down at the bottom. The average of the other provinces is about 1 bed per 1,000 more than we have. So let me just walk you through that. We have 15 million people in Ontario. That's 15,000 thousands. We're 15,000 beds short of the total of the average of the rest of the country. Ontario normally is the average of the country because we have the largest population. So we're far off. And you know what that looks like in Niagara, because prior to the pandemic, like about 10 years ago, you had the deepest health cuts of anyone in the province with your hospital restructuring plan and so on and so forth. And your hospitals have been in, at 120% capacity and things like that. That means a hospital bed, when we refer to that, is a bed that's staffed and in operation. Right? A bed is just a piece of furniture without the staff, the nurses, the health professionals, the doctors to provide the care for the patients in it. And you've had entire floors closed. They tried to close down entire hospitals, et cetera, in Niagara to reduce the number of funded beds that were staffed and in operation as part of this hospital downsizing plan. When the Ford government says it's not entirely their fault, that's true. However, when they took office in 2018, the Liberal government had finally, previous Liberal government under Wynne, had finally started to open up the purse strings and reopen beds in the last 2 years that they were in government. They had started to reverse course. They recognized the absolute crisis that we were in across the province. People were waiting in sunrooms and hallways and all this stuff to get into hospital beds. And they had started to open up a few thousand hospital beds. When the Ford government took power, they actually reversed course again and went back to cutting funding for hospitals, cutting funding for long-term care to below the rate of inflation. So real dollar cuts. Again, the goal is to force downsizing. And of course, that's what happened. And then we got into the pandemic. When Ford says that money won't help, that's just utter nonsense. I'll just show you if you're okay. I'm going to share my screen again. I'll just show you because it helps to see it. One sec. Sorry, I got to move back to a different screen. I'm going to go to funding. Can you see this? Is this showing to you? Yeah. Okay. So I'm going to go to public hospital funding. Where are we? So Ontario funds its hospitals at the lowest rate of any province in the country. again, by a significant amount. And if you look at any measure, any way of measuring that, you see Ontario's at the bottom of the country. We fund healthcare as a total in the bottom 3 provinces of the country. We fund all public services in Ontario at the lowest rate of any province in the country. I mean, so our province has prioritized cutting taxes for corporations and for the wealthy and giving the public money that way rather than funding programs and services. And so we have, as a result, the fewest hospital beds left per person. We're low on long-term care beds and so on, and patients are paying in a whole myriad of ways, and so is the staff. So, you know, here we are in pandemic, and the staff have been redeployed. That means they're like moved from one place to another to deal with surges. They lose their vacations. They're called in every time they're not working. They're called in as their colleagues, you know, get sick with COVID, you know, in large numbers, as happens wave after wave in this. Then they're called in to cover for their colleagues, and they feel guilty, you know, when they can't go or when they don't go, because they know that, you know, say you're a respiratory therapist, a person that intubates patients, you know, we're hearing from respiratory therapists that are working 70 hours a week. And when they're off, they're being called in for more overtime. There's just, I mean, they can't take this level of pressure endlessly. And yet nothing really is being done to address the hospital crisis in Ontario. In fact, the media is telling me when I do interviews, they'll say every time I do a story about the emergency room crisis in Ontario, we get the same speaking notes from the minister, the same PR, you know, speaking line. And they say, we're hiring 6,000 staff, la, 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 la. The status quo is not sustainable, la, 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 la. That's it. You know, well, they've said that for like a year and a half. They may or may not have hired those 6,000 staff. I don't know. No one could ever really track that. But the bottom line is we do know, we can track that more staff are leaving than coming in. And if you only hire in a smattering of staff here and there, and just to put that number in context, we need 56,000 staff in long-term care alone. We need about 40,000 in hospitals. The government knows that. In some hospitals, they have more vacancies for nurses than they have nurses on the ward, like in the emergency departments and so on, right? So you're not talking 6,000 staff across all of Ontario. And this isn't time for ideology, like putting them through the private for-profit colleges and things like that. You know, this is time for what Quebec did after the first wave of the pandemic, where the government recruit 10,000 PSWs, did a fast track intensive training for them, paid them $21 an hour for training, increased their pay to $24 and something, and got them into the long-term care homes in time for the second wave. They had a much better second wave. A big bump up in staff means that the workloads become manageable for everyone, and then people don't continue to leave in such high numbers. That's what we need in Ontario. The PSWs would help in long-term care, home care, chronic care, and hospitals, but we need nurses as well, and we need health professionals. They take longer to train, years. So while we have to increase the admissions to nursing schools and so on to bring them in, the only solution we have now is to bring back the ones who've retired or left to go work in the private sector or somewhere else because the workloads are impossible. To do that, they need improved working conditions. They need to be safe from violence in the hospitals, which is getting worse. They need to have decent staff to patient ratios. They need to have some control over their hours of work. And this fork in the eye that they have, if you can believe this, they have wage suppression legislation that the Ford government brought in that limits any wage increases for the staff to 1% increase. Well, like inflation's running at what, 6% or something. So it's a real dollar cut. And I don't think it's the reason, but it certainly is really a fork in the eye to these people who have worked for 3 years in total emergency, put their lives on at risk for all of us. And now facing wage suppression legislation and the worst crisis we've all ever seen. Like, it's just ludicrous. So they need to withdraw that bill, and they need to take measures to do a big recruitment drive, have some hope for the staff that are working, that there is a light at the end of the tunnel here. And if they hang on, we'll get some more staff in to help you, and conditions will improve for you. It just has to happen, but nothing is happening. Unless you believe that this thing about, bringing in internationally trained workers is, something significant. I mean, it should happen. Of course, we support that fully, but we're talking like maybe 2,000 people. Like, it's a drop in the bucket. These are PR lines that they put out to make it seem like they're doing something, when really they're doing very little of anything. They haven't even met with the unions, the healthcare unions in the hospitals. They have requests in for meetings, and they won't even meet with them. This is just, it's unbelievable. And, I've been doing this since the Harris government was in. So since the 1990s, we've met with every premier, we've met with every health minister through all this time. We've never seen, like, I just can't, no matter what their political stripe, we're not partisan. We don't tell people how to vote. That's not our job, but I just can't think of any government that would do so little in the face of crisis like this. When the Harris government brought in, they tried to cut $1 billion out of hospitals in the 1990s. Ambulances ended up on emergency redirect. All the emergency departments were full. And Joshua Flewelling, whom I'll never forget, he was an 18-year-old boy, and he died in an ambulance that were circling the hospitals trying to find, room at the inn, somewhere that would take him. The government totally reversed course through funding, but they increased funding by 12%. The next year they poured some money in, and actually the crisis was alleviated. But that is not happening here. And at the same time as the government will not improve the funding for hospitals and take some action to address the staffing crisis, it also won't do anything about the private for-profit temp agencies, the staffing agencies that are like cannibalizing the staff in the public hospitals. I don't know if you've heard about this, but it's a huge problem. So if you quit, if you stay as a staff nurse in your local hospital, you may be working beside a temp agency nurse who's making $100 an hour, or like 2 or 3 times what you're making. They choose their shifts. They don't have to work the overnight shifts. They don't have to work the weekends. They choose their hours. And it's a for-profit staffing agency. Now all the hospitals have to use them because they don't have any staff and they're desperate. And so the predatory pricing has just gone through the roof. I actually heard recently about a long-term care home, a not-for-profit long-term care home, that is going to file or might file for bankruptcy because they've lost virtually all their staff to these staffing agencies. And so, of course, as you lose more staff to them, then you have worse shortages. And those who are left to do the overnight shifts and the weekend shifts and so on and so forth have even a heavier burden to bear. It's corrosive. Like, it needs to be stopped. They have to be stopped. But the government will do nothing about them, nothing about their predatory pricing, even though they supposedly, remember, they brought in a bill to stop price gouging in the pandemic. Of course, they never did it. It was all an announcement, but nothing ever happened. But when it comes to the wages of the normal staff who have been loyal and stayed with their local hospitals and with their long-term care homes and so on, they will do nothing. Anyway, so the crisis continues. And at the same time, the sort of flip side of that coin is the government is privatizing. So leading into the election, the government swore up and down, like we did press conferences across the province warning, because they put it in their written pandemic plan that they were going to privatize the hospital surgeries and diagnostics. So we did press conferences warning about it across Ontario. And the government sent a ministry spokesperson out to deny categorically that they were privatizing leading into the election. She said, literally said, we are not expanding the for-profit clinics and hospitals. Well, after the election, we got the financial data from the Financial Accountability Office, which is like a kind of auditor that reports to the legislature. And it shows that in those months, in the 3 months of January, February, March, so this is the last reporting we have of the last 3 months of the fiscal year last year, they doubled the funding to the for-profit clinics. So while leaving our hospitals in crisis, They doubled the funding in the last quarter to the for-profit clinics in Ontario. Then 2 months after the election, so after swearing up and down they weren't going to privatize and weren't privatizing, 2 months after the election, they announced that they are going to privatize the hospital surgeries and diagnostics. And this is just my last sort of warning. That would be devastating. It would be devastating to places like Fort Erie and Port Colborne and, you know, Dunsville and, you know, smaller communities, because the for-profit clinics locate in large urban centers where there's a market of wealthy people who will pay their extra user fees. For-profit clinics charge patients, they charge OHIP, and they charge patients on top. I've called, in the Health Coalition, we've called all the private clinics across the country twice. The last time in 2017. And we asked them, we said, we're a patient, you know, if they sell shoulder surgeries, you know, we'd like to buy a shoulder surgery. We want to jump the queue. We want to get it fast. How much can we pay to get our shoulder surgery? And they told us their prices, and they were willing to sell surgeries outright to patients. That's illegal. In Canada, under the Canada Health Act, you cannot charge a patient for a medically necessary service. You can't charge for a surgery. You can't charge for a diagnostic test. We paid for them in our taxes. They are to be provided free for people based on their need, not how wealthy they are. That's how our health system works. So they take the staff out of the public hospitals. They take the profitable surgeries and diagnostics out of the hospitals, leaving the unprofitable ones behind, and the unprofitable patients, the complex patients with diabetes or who are overweight, who might code on the operating room table, right? All of them stay behind. They're more expensive for the public hospitals to deal with, and they take the money out of the system and make it worse for everyone else. It would be devastating. It's a terrible idea at the best of times. It's a hideous idea in the kind of staffing crisis that we're in right now, and we have to stop it. So we're asking communities, will you work with us to pour pressure on the Ford government to actually take action with the urgency that the situation requires to save our local hospitals and their services? Heading into this winter, you know, we've had almost 100 emergency room closures, temporary closures in Ontario. We've never seen anything like that. This is not, you know, this has never happened before. I've done this for 25 years. We've tracked cuts and closures this entire time. It has never happened before. To deny there's a crisis and refuse to take action is the worst kind of negligence and pettiness. You know, this is not about political partisanship. This is about saving people's lives and saving the staff who are working so hard for us. I'm just going to end with this. There's no question we can win. I know a lot of you, because we worked together to save the Port Colborne and Fort Erie hospitals from closure. Don't forget, they planned to close them entirely. Multiple times. You actually saved them on your own in the 1990s. We helped when it came back again, whenever that was, 10, 12 years ago. We've saved local hospitals across the province. We forced refunding of local hospitals, opening of beds, like 60 beds in Windsor. We saved the thoracic cancer surgery in Windsor. We've saved emergency departments across the province. But you better bet if they start closing down your urgent care centers for periods of time, the next argument is, well, we don't need them, you know? And Jeff, I think your local MPP in Welland area, Jeff, had done a good job bringing a motion to the legislature to force a vote about saving the Welland Hospital. But I know that attempt to close the Welland Hospital will come back. We saved it. We did that last time. We went to the legislature, we filled the galleries, we poured the pressure on, we held endless meetings, and we saved that hospital. And we can save it again. But boy, it's going to take people really pouring on the pressure. There is no one else to do it but us. And I hope that you'll join us in that. My last thing is this. Do you remember Ralph Klein, some of you? The Alberta Premier Ralph Klein? Some of you are nodding. So he was premier back in the 1990s when Mike Harris was premier in Ontario. And these were the first governments, like in Canadian history, that came in with these plans for really massive cuts to public services, like a whole revolution of cuts to public services, tax cuts, to the wealthy and to corporations, and then cutting public services and privatizing them and so on. And Ralph Klein came in with this kind of macho, thing, and he blew up the Calgary hospital as kind of a symbol of this revolution that they were going to bring. Well, actually imploded it. And if you look online, there's actually a video of it. You can find it. And he imploded the Calgary hospital, and they tried to privatize healthcare. They brought in for-profit MRI and CT clinics, like what Ford wants to do now. And the Alberta Friends of Medicare, that's our sister organization in Alberta, they fought it. They got every patient that had paid for a service at like an MRI or a CT at the clinics to save their receipts. They made a formal complaint to the federal government under the Canada Health Act. Ultimately, Ralph Klein was forced to pay back all the patients that had paid for medically necessary MRIs and CTs. It was brilliant. And when they brought in this legislation, they tried to privatize healthcare. They organized massive protests. We helped across the country, but in Alberta, they filled the galleries of the legislature. And I remember watching on TV, people were hanging from the rails of the galleries in the legislature. And Shirley Douglas, who is the daughter of Tommy Douglas, who's kind of known as the father of Medicare in Canada, and she's a kind of famous Canadian actress. Oh, mother of Kiefer Sutherland. Some of you may know him. And wife of Donald Sutherland, the actor. Some of you may know him too. Anyway, so Shirley described it to us, and she said, the prairie is really flat and you can see for a long way. And she said, you could see the cars lined up down the prairie, like just as far as you could see, coming to this protest at the legislature to stop the Klein government from privatizing their healthcare. She said it was unbelievable. And in the end, Ralph Klein called public health care the electric third rail of Canadian politics. So you know how the train goes down the tracks, and then there's the third rail that carries the electricity, and you daren't touch it because, you would get electrocuted. And I loved that. I thought, let those bastards be afraid to touch our public health care. It belongs to us. Every community in this country, in this province, has spent 100 years or more building our local hospitals, trying to get services into them, donating from our payroll, deductions, volunteering, physically building our local hospitals. They don't belong to Doug Ford or Ralph Klein or anyone else. They belong to us. And let's electrify that third rail. Let's make them afraid to touch it. Thank you very much.
Thank you very much for your inspiring words. And let me tell you, people, we can do it because we've done it before. I don't know how many of you remember when we had the big rally regarding Save Medicare and make sure that the federal government puts more money into it. And we did it. Every person that was involved put a lot of pressure, and whoops, there goes Kretchen putting more money in. Do you remember when we had the big referendum that went through Niagara? It was so well organized, and we got so many people that voted, and that was to make sure that we kept all our hospitals open, because at that time they were amalgamating 5 hospital systems, and they were looking at, let's close. They underfunded. And there was the Niagara Health System saying, what the hell am I going to do? The only solution? Oh, let's bring Dr. Kidd in. And he said, oh, well, you got too many hospitals. We got to close them. We just need to keep 3. We'll close Niagara on the Lake, toward Erie, Port Colborne. And then we had underfunding. We had huge problems in the hospitals of Niagara Falls, if you remember, and St. Catharines with C. difficile, and people died. And it turned out that in order to save money, they contracted out cleaning. And the company didn't use the appropriate and the strength type of cleaners to make sure that everything was well disinfected. and the staff hadn't been well trained. And so we had more than 25 people died. Well, that's serious. And then they brought in Kevin Smith to solve that problem. Well, his big thing is we got to close hospitals. We got to close Fort Erie and Port Colborne. And we worked hard. They don't have an ER. No, we couldn't get that, but they have an urgent care. And those beds are still being utilized very well for people with chronic care problems, etc., issues.
So
we fought, hang on, I'm not finished yet. We fought to try to keep the Niagara on the Lake Hospital open. And everyone here that was involved with Save the Welland Hospital, that was gigantic. The amount of work that went into that to make sure that we could keep that hospital open, a full service hospital. There were rallies, buses, filling Queen's Park to the rafters, petitions, more than 20,000 people. We had over 5,000 personal letters that were delivered to the legislature. And we were able to save it. But we have to keep at it. And the same, we did an awful lot of work for West Lincoln. But if we work together, we can win. Because each one of us doing our part, no matter how small you think it is, the time that you have is precious. And together we can do it. Back to you, Natalie.
So I think we should open up for you all to talk now. A bunch of people are asking in the chat about what action and concrete things like that. But I wanted to give a chance for questions and answers, right? And then the action and talk about the action plan in just a couple of minutes. So we won't take long, but did anyone have any questions before we get into that? There's kind of a lot in the chat, but general, like questions kind of about a whole range of things. Most of them are about how to take action. There's some about like linking with the NDP and so on. We're nonpartisan. Like that's our founding thing. No matter who's in government, we hold them to account. If they try to privatize, no matter who it is, we need to be able to be independent to hold them to account. But of course, we work with anyone who wants to work to protect public health care. And that includes all the opposition parties right now who are all committed to stopping this. And so, while they're committed to that, we'll work with them. But other than the action plan, I think mostly people want to talk about the action plan. So let's just go there. I don't see any other questions. Okay, so locally, my question is this, like in order to deal with the staffing crisis in the hospitals, we got to pour pressure on the Ford government. It needs to be visible. Ontarians need to see people like pouring out into the streets to stop this. And they need to see that challenge, because every press conference, the Ford government says, we're hiring 6,000 staff. And it seems like, the cameras will show, crisis in the emergency department, government person saying we're hiring 6,000 staff. And it sounds like that's the answer and it's done. And nothing ever happens from there. So we need to challenge that. We need to put some pressure on. We're planning a couple of events in different parts of the province. We didn't want to plan 100 before the winter break or Christmas. We wanted to try and do several large ones that people would see, that media would cover, and then more through the winter and spring and so on as we need to. So in Ottawa, we're doing one December the 9th, which is a Friday. On December the 12th, which is a Monday at noon, we're going to fill University Avenue outside the hospitals, the University Health Network, Sick Kids, Mount Sinai is there. It's all lined with hospitals and the legislature is right there. I wondered if people from Niagara wanted to go there and join in. The other option is to do something closer to home, but it can't be 20 people on a street corner. Like, this is not the time for a show of weakness. This is the time for a show of strength and, fortitude, like demanding action. I think our idea was to go and thank the hospital leadership and the hospital workers, candles and flowers and messages of support and thanks, and then messages demanding that the Ford government actually provide them the action and support that they need, and stop privatizing, so the two kind of messages together. So we could do it there. I was kind of inspired by these marches on bridges that the nurses did in Quebec. They've filled the bridges, and it was nurses and the public came out to support and so on. We wondered about doing something there, but there was possibly a bridge over the 406, but there wasn't really a great bridge. And so I didn't know so I wanted to just open that up for discussion. And then I think we'll try and do something in Windsor as well, like December 9th or the 12th. So what do you think about that? Like, would you go to Toronto in significant numbers? Do you have another idea?
Could you raise your hand if you'd be interested in going to Toronto? If we could see there's a little reaction, raise your hand. It gives us an idea of how many people would be interested. Riley, can you count them?
Does everyone know how to? So on the bottom of your screen, if you don't see a toolbar kind of across the bottom, just move your cursor down. And then there's a reactions button. It's got like a smiley face with a plus. If you click on that, at the bottom of that little window that pops up is raise hand, and you can click on that. And to lower it, you do the same thing. Okay, so there's a bunch of people.
Okay. How many people would be interested in sort of a show of force, either on a bridge or at a major intersection in St. Catharines, which would be like 4th Ave and maybe
So can you
Road.
let people lower their hands first, okay? So can you lower your hand, use the reaction button and lower your hand? Okay, go ahead. Sorry, hun. That's good.
Okay, so how many people would be interested in sort of being out and really making a lot of noise near our hospital at a good intersection? Could be in St. Catharines. We might be able to do something in Welland. So how many people would be good for that? Okay.
And you can, people can vote for both. I see
That's
some
right.
people have,
All right.
Okay, well, it looks like the majority is for local, but it depends. I mean, some people might do both if they weren't the same day.
One of the things also is I see everyone here, but I don't have your emails.
We do. We've got all of them.
Okay.
Yep.
So in order to be able to organize all this, we do need to be able to meet locally, either by Zoom or in person or both, sort of a hybrid, to be able to plan what we're going to be doing.
So, but let's try and get it like as close to a firm plan while everyone is here as we can. I see a lot of people are saying, do something on the bridges here, on one of the bridges here. Is there a spot though? I would be interested in St. Catharines places, do bridges in Niagara region. Don't want to be part of a large crowd. Well, it would be outside and masked. So bridge rally, would it have associations with a convoy? No, I think people know the difference. We need lots and lots of people. We have bridges. Do something in Niagara. I'd go to Toronto if I could. So, but there's kind of a mix, but I think if we had a concrete proposal, people could sort of rally around it and we can sort of get to something fairly concrete while we've got, 60 plus people on the meeting here. There's two people with their hands up. Should we ask them? I think you might have some feedback on this.
Okay, Andy?
Oh,
You have some?
no, I think that their hand went away. Okay.
So there's two possibilities in terms of bridges. And one of the concerns is always to make sure that it's close to parking. So if you think about 4th Avenue and not Martindale, yeah, Martindale. There is a Dollarama. We're close to a bridge. We could get things organized. And then the second bridge is near where was it First Louth and the hospital. A little dicier in terms of getting parking, but those are two possibilities.
So if the first one's better for parking, what was it? 4th?
They're all close to 4th Avenue.
Yeah,
The first one is about 3 blocks, I think.
because we could march from one, like assemble and then march, right?
Yeah,
Stop on the bridge, drop a banner, wave, la 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 la, and then go along.
it's a bit far from the hospital. Okay.
Does it have to be at the hospital?
No,
The hospital is far from everything, right?
that's
Like it's
true.
in the middle of a field.
Well, it is in the middle of field, surrounded by a lot of big box areas now.
But Sue, that's the route to the hospital. That's where all the ambulances go. They use that,
That's right.
right?
Yeah.
So
Yeah.
it would be very visible.
Yeah, and we wouldn't, by the way, block ambulance, like we would be
No,
on
no.
the sidewalks and whatever. Okay, yeah,
know.
yeah, yeah. So what about there? Why don't we just say there and which day? So which bridge, can you just reiterate? Because I don't have it straight in my head, which, and Fiona's got her hand up. Which bridge we're talking about? Like where exactly?
Fiona, do you have a question?
I had a comment, Sue.
Okay,
I've been really occupied over the last few weeks with fighting Bill 23. Ford's omnibus bill, which hits at everything from conservation authorities to affordable housing to local democracy, and everything this government is doing is connected to everything else, as I know you and Natalie and a lot of other people are totally aware. We've been this campaign has been hitting the offices of progressive conservative MPPs. I mean, most of the time they're not there. It's not to try to embarrass them or anything else. It is to make the government, the caucus of the progressive conservatives, understand that people are so concerned about these issues that they risk losing their seat at the next election. I mean, personally, I love everything that you've done, but we don't need to tell Jeff Birch or Jenny Stevens or Wayne Gates that we care. We need to tell Sam, who has just done a great thing for his community and managed to get an okay on that new Grimsby Lincoln Hospital, for which his constituencies are so grateful. They returned him, with a big majority. But the point is, if they can't keep it staffed, what is the point?
Yeah, and will they have the surgeries? Are
Yeah.
they all gonna go to Hamilton?
That's right.
Yeah.
That's right.
birthing.
The thing about government MPPs is, believe it or not, they don't know what any of us knows. They do not have the time to read any legislation. They don't have time to keep up on what is actually happening. And their own government lies to them.
So are you proposing like to move it to Sam somewhere? So just for people who don't know on the call, she's talking about Sam Oosterhoff, who's the MPP. He's a conservative and he's over in like West Lincoln, Grimsby area.
He's in Beamsville.
Beamsville.
His office is in Beamsville. Yeah.
So are you proposing, but if we go there, will people come? Like, because 20 people outside the MPP's office who don't vote for them anyways is not going to help us, not going to make any difference for us, right? So people, like, I was hoping that we'd make this visible to like regular
But the
Ontarians.
point is, I said, I'm just saying
Yeah.
that what's happening with this Stop Bill 23 campaign.
Yeah,
is
yeah.
I know this because I just heard from a little conversation with Mike Schreiner's been hearing from PC MPPs that they're getting really, really nervous at the fight back that they are getting outside their own offices and from municipal councils within their
Yeah,
ridings.
in Oakville and Milton,
Yeah.
all of those
Yeah,
areas.
yeah. So I'm
But-
just suggesting that the Ontario Health Coalition think a little bit about perhaps adopting a slightly different methodology.
At this point, we're just trying to wake up Ontarians to this, because, I would expect that people would be out in the streets in the thousands over this now, and they aren't. And my worry is that, it's behind the closed doors of the hospital and you see the emergency room in crisis, and then you see the government say we're hiring 6,000 people, and that just puts it to bed for everyone. So I'm trying to wake up Ontario at this point, not like, I think we got to build from there. And the people sort of asking, where's this going? Like, how are we going to stop it? Well, I mean, our idea is we're doing town hall meetings across the province. We're starting the initial actions. The unions in the hospitals are all meeting together and talking about ratcheting up. They're doing work with their members. I'm hoping this moves to job action of some sort on their part and on our part. We're trying to sign up 1 million people who will agree to be defenders of public health care, stop the privatization, stand up for our local services, and then move to a referendum, a cross-province referendum, and stop them from cutting and privatizing our local public hospitals. 1 million people voting in Ontario would stop any government, but we got to build to that. And at this point, we need to get, we need to make it visible. We need to make it visible and can't just kind of do like, anything that looks sort of like the same old. We need to capture people's imaginations a little bit. But I agree with you totally, Fiona, like that strategy working in those areas in the Greenbelt where, there are conservative MPPs and pouring the pressure on them is exactly what needs to happen. And we need to do that all across Ontario. We're meeting in all of these rural communities where the small hospitals have had their emergency departments closed over and over and over again. Clinton, Chesley, Seaforth, et cetera. We're doing that this week and next week. And we'll continue. And we're building in those communities as well. So this is just what do we want to do in Niagara? So I think sorry to talk too much here, but just to make a decision, would people go to Beamsville, or do you want to do something at the place that Sue, which could you just repeat again, Sue, what are we talking about? Just because if I was
think,
confused, I think
yeah,
others might be
the
confused.
best place is the Martindale Road, the bridge that goes over, it goes over the 406, and it hooks up to a big intersection with 4th Avenue. Okay, so it's very visible, and there's parking. There's a couple of parking lots that we could park. We could do a march, go up and come back. So Martindale, first Louth, it's a little bit further. It's closer to the hospital. Not as much parking.
I think the more options we start giving, the more impossible it's going to
Okay,
be to come to
so-
a conclusion.
I
So
said
if we say the
Martindale.
first one or Beamsville, maybe we could vote. Can we vote again?
Yeah, I think
can vote
Julia
twice.
has a question. Julia?
Well, I just wanted to underscore the fact that if we do have a presence near hospitals, it would also give us a better showing for the workers that we're really supporting the hospital workers, just so that community also, like Natalie was saying, you want to say thank you. It would bolster them as well, morale, to know that there's actually a coalition fighting for them close to where they're working. And I do believe that bodies have to be on the street already. The Zoom has been beautiful, but bodies have to be on the street. If we had a themed spectacle kind of march where there's either some kind of character or something so that it could be repeated throughout the region, it would be identified. we really need to make this like a physical, a hydra-headed thing that's out there screaming and saying, we need action. We need action. That's what we need now.
Okay.
That's all.
Yay, yay. Okay, but so should we vote, Sue, to choose?
Yeah.
Okay, everyone knows how to use your reactions, right? So the vote is what? It's Martindale Avenue across the bridge over the 406 to 4th Avenue. That's what you said?
Yeah,
Okay, who wants that one? The other option is going to be Beamsville.
Oh, it's both good.
You don't know how to vote. Okay, we see you in the chat there. Okay. Both. Okay. Okay, anyone else? Oh, thumbs up there. Okay. Oopsie, Riley, are you looking for us here? Riley's our staff person who's on the line here. Oh, there's a check mark on the other page. Okay. Okay, so let's put those hands down, if you don't mind. Susie Q, I'm handing it over to you. Do you want to, where at Beamsville would we go?
Beamsville would be at Sam Oosterhoff's office. There is limited parking. But you can park underneath you need to have a big parking sign with a direction, but you can actually park under.
So
under
where
the
is Sam
grocery store.
Oosterhoff's office? Like without getting into all the details.
Yeah, well, just there was a comment about parking. There is
Okay, sorry.
additional parking underneath the grocery store.
So everyone who has their hands up, can you take them down for a second? Because we're just gonna reopen the vote. No, can we just stop the comments for 1 second and finish the vote? So where is his office? Like, I don't know if everyone knows.
It's on
King
it's
and
in
Ontario.
Beamsville on Queen Street. It's right downtown.
Right on the main drag. Okay.
Yeah.
Okay, so who's voting for Beamsville?
Oh, that's good too.
Okay. It looks like actually there were. Oh, there's another check. It looks like there were more for the first option,
There was about 17 for the first option,
10 for the second.
8.
Okay, 10. 1, 2, 3, 4, 10. Okay, so it looks like the first option, if we're gonna go by that vote. But you know, the truth is people will come wherever you, it's good to just make a decision and then go for it, right? And then my question is which day? Because like that Friday or the Monday would be ideal. If it's the Friday, you have a chance of sort of getting the weekend media and so on. Also, the Friday drive home is a big drive home. But I don't know if the 406, like, is it busy going both ways? Like, and when, like, would you then have to do the morning rush hour or the afternoon rush hour? Or, what time would be best? Most visible, or could you do noon? Is it busy? I mean, Fridays people like rush hours
Well,
to be long, right?
It's not so much the 406, it's the Martindale Road that is busy.
Okay,
All right, the 406 is busy, but there's a lot of traffic on Martindale. So, and I think it'd probably be easier to get people there not during morning rush hour. I don't know, noon or around 3 o'clock, 4 o'clock in the afternoon. There's a lot of people that are in and out along that road on that section. So
what do people think about like noon or 3 or 4? Lots
There's
of
a lot of
Christmas
school
shopping.
buses out and about at 3 o'clock. That really ties up traffic. Because most kids go by bus to school.
Okay. So you're thinking noon, Carol?
I'm not sure that's the best time. It's just that if you choose 3 o'clock, you are going to run into bus school bus trouble. Probably like 4 o'clock would catch more people and more attention.
Yeah, and they're all going to the grocery store too.
So is that Friday or Monday?
There'd be more traffic on a Friday.
I think so
Absolutely.
too.
Yeah.
By a long shot. Okay, so what about that then? A proposal for oh, there's people. Well, you know, I hope everyone's okay with the democracy because we're not gonna be able to sort of please everyone. But what are people okay if I know earlier in the day is better because you get longer media, but that's okay. I mean, you're gonna get media anyways, I think. Are you? I think so. If you say like 3, 4 o'clock on the Friday. And we can bring like, you know, those, when you go to the dollar store, you can get those hand warmer and foot warmer things if it's chilly out, and, you know, then we need people to bring like messages and of support for the hospital and demanding for do something, you know, et cetera, stop privatization. We should have a banner for the highway. You know, that kind of thing. So we will need to do some local planning together. Okay, so does that sound okay for people? It's going to be really visible there. Like, I'm kind of excited about where you're doing it. Fiona and Julia have their hands up. I don't, Sue, I'm passing it back to you. Sorry.
I just wanted to say, Natalie, that Terry has just volunteered to set fire to something.
For those
Sorry,
who
guys,
don't
info.
remember, when they tried to close the Fort Erie Hospital. No, yeah, it was
That's right.
Fort Erie. No,
This-
Port Colborne.
Listen, that story went around the world.
It was hilarious. He had
Right.
it was a prop. Did not set fire to the hospital. You know, he had an H. It was a burning H.
No.
Anyway, the Hamilton police came down and it
With a
was
burning H.
insane.
Okay, yeah, Mary Ann.
Fiona and I
has,
was driving around
Dude.
Niagara trying to find out where they took him.
We have a couple of people with their hands up. Mary Ann, unmute yourself, please.
No, thank you.
Okay, all right. Julia,
Okay, I just want to share this. This is sort of a cuckoo looking bird, very frantic. And I'm thinking if we could do something that's, you know, evocative, just that captures people's imagination, because the slogans are good. We know what the arguments are, but and the time, I just want to confirm, I live very close to where that intersection is. I live near Hotel Dieu. There's early morning traffic starting at like 4:35 to go to Hamilton, Toronto here. So the coming home traffic is perfect around 4.
And
But I guess I'm just thinking, all the labor parades in Toronto always had big puppets and things that caught people's imagination. If we could find, even if it means getting that insignia of the umbrella with something, just so that we have something that's emblematic of this fight, you know, so that it can be used in many different ways. And that's all. Because we may not always have bodies, but symbols are really powerful.
okay.
And we could
thank you.
ask the paramedics. So, and Julia, you're such an artist. Like, I love that. So yeah, we should figure out some of those visuals, right?
And this
Riley, Sean DeMello is waiting to get in, I think, in the
Okay,
meeting
go.
room. And I just wanted to mention, we could ask the paramedics to do a drive-by, you know, in support of the hospitals, you know, police, fire, like our friends who want to support, you know, their colleagues who are hospital workers who are so beleaguered, you know, that would be great. And yeah, I think that would be kind of neat. Marianne Bradley, who had her hand up, had put in the chat, yes, yes, yes. And I think that was the comment.
Yeah, Julia Lucas,
Go ahead.
unmute yourself,
Yeah,
Julia.
well,
Hi, good evening, everyone. Happy to see you all. I'm wondering about the actual gathering location. What is the proposed gathering location specifically?
It'll be either at the Shoppers Drug Mart where they have all that parking, or it's going to be where Dollarama is. Well, it'll be on, there's two places on either side of the street.
Are you proposing a march to go to, from there to the hospital?
No,
No?
I
And
think
another
that's too
question-
far, right?
yeah,
The other question is the banner drop. Is it on the, it's on the Martindale, so it would be near the Shoppers Drug Mart in 406.
it'll be right front. We're gonna do the banner drop. Hopefully we have two, one for each side coming and going to 406.
Okay,
And it'll be off the bridge.
okay. Did you want to do multiple bridge drops on the same day or just one?
You could do
We
some in the
could
morning.
if we have the volunteers and the banners.
Yeah,
It'd be good.
okay. I'm just
Um,
wondering about a march. That's all. I'd like to fit that in. That would be nice. That's all.
Well, we could march, we would be marching up to the bridge and then back and making a big hullabaloo. But all the way to the hospital is pretty far. Fiona? You're on mute, Fiona.
Okay. I'd just like to, I just wonder who we're targeting here, because I understand trying to bring the healthcare unions and other unions in. That's fantastic. Absolutely, we should do that. But there is a group here I wonder whether we've spent enough time trying to contact, and that's parents. This current health crisis is hitting children really hard. And parents really care about their kids' health and about whether their child is going to be seen, if they take them to a hospital, in 14 hours or at all. Then there are organizations on Facebook, like For Our Kids, for instance, is a big one that's on social media that we could really spread the word to, because I think we need some new faces. I think we need to try and get more different kinds of Ontarians galvanized to care about what is happening to our public health care. I'll shut up now.
No, I love that. I think we should too. And so let's figure out ways that we can reach them. I also think in Toronto, we've this whole kind of group of doctors who've been speaking
Yes.
out. I think we should try and get the docs in Niagara too. There's got to be a whole bunch of them who are really, really infuriated at what's happening here. And then the others are all those retirees groups, all of those seniors organizations and retirees groups and so on and so forth. They're the ones who need healthcare the most of anyone.
Yeah.
And we're not asking a ton. So maybe they could, help spread the word or try and get people out as well. Yeah, patient groups, etc. Be
Yeah,
fun.
we've
So we
been
need to have
sending
an organizing meeting, eh, Sue?
I think so.
That's
yeah.
right.
Sorry.
And just to let
Yeah.
everyone know, we have been touching bases with a lot of the retiree groups
Mhm.
and sending them information. So
Yeah. Yeah. And Natalie, you've been just so brilliant at, massaging the message to suit different populations. And I think that's what we really need to do here, to show to people, this is not a seniors issue, this is an everybody issue. And that's what this Ford government is doing right now. It really is attacking everybody.
And I see in the chat that there's people who are disagreeing about the time and date and location. And I'm sorry, we'll just keep going round and round and never get anything off the ground. I think at some point we just have to decide there's no perfect day, no perfect place. And this won't be the only thing we ever do, right? This is one thing, and let's make it a big thing and as best we can. But all the ideas are welcome. So I got to go on because it's 8:18 and we wanted to end in the next sort of 10 minutes. Can I
Yeah.
show the rest of the action plan?
Yeah.
Yep.
So that's to make the Ford, to pour on the pressure, to wake up Ontarians and sort of start to pour on the pressure about the situation in the hospitals, make them take action about it. And I'm thrilled. Thank you. I think it's going to be fun and interesting, and I'm coming, okay, down there so I can see all of you and help out in every way possible. So Riley, you want to share your screen for a minute? Riley's here. He's our well, he's a young person. For the people looking at young people, he's one of our staff. And so if you go to our website, and for those of you who aren't, like, don't use websites, we can send this like as by mail. Can you just scroll to the top? So our website is, if you just look for Ontario Health Coalition in Google or whatever search engine, it's just ontariohealthcoalition.ca. That's the address. But so that's the top of the website. And if you scroll down, you see Defend Our Public Health Care. We're trying to get 1 million people to sign up to be defenders, public Medicare defenders in Ontario. That's to stop the privatization. And what people can do concretely, well, you can sign up. Your info, like, we'll never use it for anything without your permission. So we're asking if you want us to keep in touch, we will. If you don't, we won't. But what it does, can you scroll further down? So we just started this. And we've got a couple hundred so far. It just says first name, so it doesn't reveal your last name at all, but it'll say like Fiona in Welland has it says taken the pledge, but I mean signed up, right? And so that's how, so it counts the number of people. And then can you scroll back up again? And we're gonna try and get to 1 million. The point is that those from that list who volunteer, so only those people who check off that they want to volunteer, when we're trying to pull together a referendum across Ontario to stop the privatization of the hospitals and to like restore and win support for the public hospitals, we'll ask that 1 million people to help us, right? We'll ask them to vote, etc. And then you can also help if you click the Here button there by handing out leaflets in your community. You can print them and hand them out like door to door or in your community groups or in workplaces and so on. And then we have that's what the leaflet looks like. So it just goes on a normal sheet of paper and you fold in half. And then the other thing is that, like in Alberta, and like we did this before as well in Ontario, we're trying to get people who've been charged for services in private clinics, like people who've gone to get their cataract surgeries done. This is common, and charged $200 an eye for extra eye measurement tests, or charged for the cataract surgery like $2,000 an eye or $1,500 an eye. I just heard from someone who paid $7,000 for the cataract surgery. They weren't told that, you know, they don't have to pay that. Sometimes the doctor mixes in, commingles like some kind of lens thing with the cataract surgery in order to charge the patient these exorbitant, they are truly crazy prices for the cataract surgery. It's $550, by the way, under OHIP. It's a 7-minute surgery. So like the doctors are, you know, most of them are billing around $1 million or more to OHIP. So, you know, this is just greed. But that's the most common thing that happens in the private clinics in Ontario. But sometimes in the colonoscopy clinics, they'll tell you have to pay for a dietitian, or in the endoscopy clinics, so you have to pay for a blanket or this or that or the other. So we're trying to collect from just surveys. They're really simple. Did you pay a fee for a service in a private clinic? How much was it? What was it for? It can be anonymous, or you can give us your name. We're going to hold press conferences with the patients who've been charged in private clinics, you know, really expose it. And we could bring a writ of mandamus, which is a legal mechanism by which you force a government to follow their own laws. We have laws that protect against user fees for patients in Ontario and Canada. We have the Canada Health Act, which forbids that. It's illegal. And we have the Protection of the Future of Medicare Act. So that's what we want to do. And we're asking if you can help. So if you belong to a seniors group or a family council at a long-term care home, or, you know, other kind of community group, could you print off the surveys and bring them? See if people will fill them out. It's just a few minutes to fill it out. It's really simple. And then we can collect the information and we can move forward with court action to try and force them to stop the extra billing, which will close down a bunch of the private clinics, or, you know, publicity and so on to push back against this attempt to privatize. Yay. So those are the things that we're asking if people can help in to stop the privatization. And again, where is this going? Well, ultimately, you know, job action, referendum, you know, real like serious, you know, the kinds of things that governments respond to in a very serious way. That's it. We can unshare now.
Okay, so that's a lot of information.
Oh, Andy has a question.
Yeah, Andy's got his hand up. Andy?
Hi there. I'm his wife, Colleen, actually.
Oh,
Will there be an email going out with the
Yeah.
information that we've talked about, with the date and the time of the protest that we're hoping to have, and all of that kind of information?
Yes, there will be. I will be getting the emails, and we actually need also to set up an organizing meeting because there's a lot of work that needs to be done, a lot of discussion so that we have something that's really good. And in terms of reaching out, we need everyone to help to get the word out and to talk to your family, friends, you know, all the groups that you belong to, the coffee shop where you get your your coffee.
so maybe we can try and get the email out like this weekend, Sue. If you and I discuss, we can get a follow-up email out so people get something fairly quickly and can move with it.
That's
Does
right.
that
That's
work?
what I was anticipating.
Okay.
I just also wanted to say I am an administrative professional and I have been for 15 years. Organizing things is the name of my game. And I've just recently become aware of this organization. I'm very interested in devoting very serious time to you. I do not have children, so I have time. And thank you. Thank you for doing what you've done so far. Thank you for putting this meeting together. Thank you for caring when the people who are supposed to care about us have stopped. Thank you.
Thank you very much,
Thanks,
Elena.
Colleen. So lovely. Well, what a nice note to end on. I think people are done, like quiet. So we're going to save the chat, okay? Because there's a lot of comments and I didn't get a chance to read all of them. And Sue, well, you and I we can share it. Riley, can you save it for us? I just don't want to go and lose it. Okay. And then, so we'll be back in touch by email. And did we collect people's phone numbers, Riley? When you registered, did you have to put in a phone number? I think so, right? No one remembers? No phone
No,
number?
we did not when we did, no.
Okay. Okay, so it'll be by email and
Sorry.
then we can go from there, but it would be Friday, December the 9th at 4 p.m. I think people have said at either the Dollarama or the dollar store or the Shoppers Drug Mart across from it by the bridge by Martindale Road and the 406. Am I saying this all correctly? Okay, good.
Yeah.
Okay.
So before we go, there was a lot of work done by numerous volunteers to call people and I really want to acknowledge them because it's not everybody's favorite job, but we certainly appreciate it. And we've been able to sort of help update our calling list. So a big thank you to Julia Lucas, Julia Blusiak, Brian Stokes, Ivan, Stephen, Bill Doyle, Charlene Heckman, Susan Rutledge, and Pam Lockey. So thank you so much. That was, we were able to get the message out and people forwarded it. So thank you. And this is how we're able to move forward, is everybody, doing a few phone calls, helping out, getting stuff organized. And the more people, the better.
Yay.
And there's a lot of little jobs and a lot of big jobs, but we know from past experience that we can do it. And here in Niagara, we can get it done because we've always had really great support. And I'm looking at a couple of people here who were very prominent in helping with saving the Welland Hospital, like Fiona. Sala did a lot of work. So we really appreciate everything that people do.
Yeah.
And to tell you, we never forget you. And Susan Rutledge also, sorry, I forgot Susan. Okay.
Thanks. Big Run and Sue Hutt, thank you, my friend. Thanks so much. Okay, so we'll see you all very, very soon. I look forward to it. Thank you. I think we accomplished a lot. Yay. Very, very inspired by this. Thank you. Good night,
All right.
everyone.
Bye-bye.
Riley, you got the chat, right?
Yes, I did, yeah.
Yay.
Okay.
Okay. Bye, everyone.
Thank you. Be well.
Bye-bye.
Be well.